I was pleased to vote for the 21st Century Cures Act because of its significant investments in research to cure disease and advance the approval of life-saving medications. I also supported this legislation because it contained many critical mental health and substance abuse prevention provisions, including reauthorization of a bill I've championed for many years, the Sober Truth on Preventing Underage Drinking Act, better known as the STOP Act. Since its initial passage in 2006, the STOP Act has facilitated federal efforts to reduce the public health crises of underage drinking in the United States. 10 years after the passage of the STOP Act, it is clear that its comprehensive approach is making a difference. According to the 2015 Monitoring the Future survey, lifetime alcohol use by 8th, 10th, and 12th graders is the lowest in decades. However, despite the progress we have made in the last decade, underage alcohol consumption in the United States remains a widespread and persistent public health and safety problem. Alcohol is related to the 3 leading causes of death among 15 to 20-year-olds and continues to cause 4,300 deaths each year among youth under age 21. These alarming figures clearly indicate that more must be done. One of the primary components of the Act is the STOP Act Grant Program. This program provides community coalitions with the funds to prevent and reduce alcohol use among youth and young adults. The program also enables organizations to strengthen collaboration and coordination to prevent and reduce underage drinking in their communities. Another important element of the STOP Act is the Federal Interagency Coordinating Council, which brings together high-level leadership from 15 federal agencies to coordinate federal efforts to prevent and reduce underage drinking and to send Congress an annual report summarizing all federal agency activities related to this serious issue. The law also finances public health research and a national media campaign. I have worked very hard with advocacy groups to expand resources to the STOP Act. While this bill does not include that resource expansion, I am grateful to my colleagues on the Committee on Energy and Commerce for including this reauthorization in the 21st Century Cures Act. I want to assure the STOP Act community that I will continue to work for the much-needed expansion in resources so that we may continue to address the health and safety problems that alcohol creates. While I'm glad my legislation was included in the 21st Century Cures Act, I am very disappointed over the continued cuts made to the Prevention and Public Health Fund. For years, I have worked with advocacy groups and have fought alongside my colleagues to secure government dollars for this fund. It is my hope that in the new Congress, my colleagues on the other side of the aisle will understand that funding for the prevention of curable diseases is the foundation for any healthcare reform. Cutting programs like the Public Health Fund contradicts this important notion.